Hello everyone, and thank you for waiting. We are just about to start the webinar, so I wanted to just say thank you for everyone's patience, and good evening for most people, and also good morning for those of us in the US and across the world as well. We're very proud as VIA Global Health to welcome Hadley Health Technologies, who is the supplier of the Pumani Bubble CPAP device. It's a device that many of you are probably familiar with, but for those of you that are not, this will be a good opportunity to learn about that device, to see a demonstration, but also to ask questions directly with our supplier in the US. So a little bit about VIA Global Health for those of you who are not familiar. So what VIA Global Health is a medical equipment and consumable sourcing platform with 50,000 products, which allows you to source, quote, purchase, and ship very easily, faster, and also more affordably. So we have medical providers and distributors throughout the world that buy through us, and we have suppliers like Hadley Health Technologies throughout the world that provide high quality and affordable technologies available to you. What we do as VIA is create that access between the two sides and then manage the transaction for you. So before I introduce Jocelyn, just a quick explanation. Again, the Pumani Bubble CPAP is a low-cost respiratory device for newborns and children. One of the unique things about this product is it was developed in Malawi, but is manufactured in the US. So it brings that local insight and knowledge, but with high-quality craftsmanship from the US. So with that, I will introduce very quickly Jocelyn Brown, who is the product manager at Hadley Health Technologies, specifically working on Pumani Bubble CPAP.
Hello everyone, my name is Jocelyn Brown and I'm a product manager at Hadley Health Technologies, and I'm going to go through the Pumani Bubble CPAP device today. That's the device here in front of you. So as Brian mentioned, the Pumani is a respiratory device for newborns. It's a type of bubble CPAP device. So if you're not familiar with bubble CPAP, CPAP, it stands for continuous positive airway pressure. And it's been used for over 40 years in the US to treat respiratory distress in premature newborns primarily. So babies that are born prematurely that have underdeveloped lungs, they need a little extra pressure in their airway to keep their lungs open and to allow them to breathe normally. And so this type of device can be many thousands of dollars in the US and Europe. So many years ago, we started working with a group of clinicians in Malawi to design a bubble CPAP that was appropriate and robust and effective in any sort of setting, including Malawi. And so that's how the Pumani came about. Pumani actually is a Chichewa word in Malawi, and it means to breathe restfully. So the name was from the Malawian nurses who first used the device, and we've been working with the clinicians in Malawi to update and refine the design, and then we brought it to the US and are now manufacturing it on a large scale here. So I'm going to go through the machine itself, the components that come with the machine, and then at the end I'll also open up the machine so you can see inside. And it's a fairly simple device, and that's part of the design. And then I'm happy to take your questions at the end. So on the front of the device, I will just move the webcam a little bit closer here. So you have a water bottle here, and the height of water actually determines the air pressure that's delivered to the baby. So many people think that this is a humidifier. It's actually not a humidifier. It's the component that provides the pressure. And this is standard for any bubble CPAP device. And once I set up the machine, you'll see that when the machine is running and the baby is receiving the pressurized air, the water in this bottle will bubble, hence the name bubble CPAP. On the front of the machine, you also have two flow meters. There's an oxygen meter that reads the oxygen flow, and a total flow meter, and that is the total flow that's being delivered to the baby. And then on this side of the machine, we have four controls. There's a baby port here. That's where the tubing to the baby goes. This is the bottle port, so you'll have tubing from here to the bottle, which I'll demonstrate in a moment. You have an oxygen port here, and that's where you would connect your oxygen, either from a concentrator or a cylinder or piped oxygen. And this is the power switch, so that turns the machine on. And then you'll also see there's a small green light that turns on when the machine is running. So that's the front of the device. I will now show you how to set up the machine. So I'll move out just a little bit. So with the machine comes a pack of accessories. We call this the starter pack, and it includes everything that you need to start CPAP therapy. So inside of the kit, there's what we call bottle tubing. It looks like this. It's a small piece of tubing, and it connects from the bottle port here to the bottle. And these connectors, they're very secure. They snap into place, so they don't get dislodged during use. So you have your bottle tubing that connects here. You also have in your starter kit, we call this the patient tubing, and it is the tubing that goes from the machine to the patient. So I will attach this tubing. So the connection at the machine is here. We call this the baby port, and that snaps into place. And then at the end of the tubing, you have this small plastic elbow. We call this the fish elbow. It looks like a small fish. And to that end is where the nasal prongs are attached. So included in the starter kit is a tray of nasal prongs. There's 6 prongs in the tray. This is a variety pack, so you can get 6 different sizes, sizes 0 through 5, for all different size babies. But you can also buy packs of just individual sizes as well. So for this patient, I'm going to choose the smallest size, a size 0. And they're rather tiny, but I can try to show on the video here. They're made of a soft silicone material. They're very flexible. There's a Pumani logo on the front, and then there's also a small number here that tells you the size of the prongs. And so if you're familiar with Hudson prongs, these are very similar, but they're more durable. They're made of this durable silicone, but also very soft and slightly curved as well, which conforms to the face. So at this fish elbow, we're going to connect the prongs. And then on the other end of the elbow, or the other end of the prong, is where the second elbow is attached. So this is the piece that is attached to the baby. So I now have a doll, which I can demonstrate attaching the tubing to. So we also have in the starter kit, we have 3 different hat sizes. There's a small, a medium, and a large hat. And for this baby, for most babies actually, you'll probably use the medium hat. For very small babies, the small hat works, and for babies 6 months to 1 year, the large hat is best. And actually in the US, this is the attachment method for most CPAP devices. So the hat is actually really key in keeping the tubing in place on the baby. We adapted this method from the attachment that is used in the US. So you have your hat on the baby. There's a Pumani logo on the hat. And we also have, in the patient tubing bag, there are 2 hat clips. And these slide onto the brim of the baby's hat and keep the tubing in place. So I'll demonstrate how these attach. And we've designed these clips ourselves. So previously, nurses were using safety pins and elastics, which work fairly well, but they're difficult to attach, and people also had some concerns about safety pins near a baby's head. And so we designed these hat clips that seem to work very well. So you have your hat and your hat clips on the baby. Now the tubing will be placed through the hat clips, looped through like this. And I should also note that typically the machine should be on and running before the tubing is placed on the baby, because you wouldn't want to place the prongs in the airway if there isn't air coming through the prongs. So you can see here, this is the attachment. It took 10 seconds or so to attach, and it allows the baby to move back and forth, and it keeps the tubing in place. And so that is a really important part of CPAP, is making sure that the attachment is secure. So now I'll zoom back to the machine. So our machine should be running when the baby is on. So I'm going to plug in my machine. So with each Pumani, you also receive a power cord. It's a UK style power cord, but you can place other adapters on the end of it. So there's a plug in the back of the machine. And I will switch the machine on here, the power switch. And there is a low humming from the machine, and part of that is due to a strap on the back of the machine. So during shipment, there is a zip tie here, and this ensures that the pump stays in place during shipment, but once you receive your Pumani and it's installed, you can cut this tie and the vibration will be slightly less. So on the front of the machine, you can see the green light is now on. And if I had an oxygen source, I would connect it here. Typically, babies would start around 3 liters of oxygen, and I would read that oxygen reading here. And then the total flow can be adjusted here. And right now we are at, hard to read on here, but you should start around 6 liters per minute of flow. So my total flow is at 6. My bottle pressure, that sets the pressure in the line and to the baby, is at 6 centimeters. And when the prongs are in place and the baby is receiving the therapy, you should see that there is bubbling. So it may not be bubbling right now. Turn it up a little bit more. And I'll just switch this off to minimize the sound. But that is how the Pumani is set up and attached to the baby. And I will now go inside of the machine so you can see how the machine works. So the Pumani on the outside has 6 different Phillips head screws. You can see I just have these 2 in the back, and these should be removed to go inside of the machine. And the machine itself, it's designed to be very durable, so it is made of sheet metal. It's a little bit heavier than other machines. It weighs about 8 kilograms, but that makes it very durable, and we've shipped it all over the world without issue. So it's very well designed for shipment, and our packaging is also very secure. So once you have all 6 screws removed around the Pumani unit, you can lift the tray, lift the lid like this, and this completely detaches. And so that allows you to easily get into the machine if you need to. So I'll bring this a little bit closer and turn it so you can see inside. So as you can see inside of the unit, it's quite simple. We have here the air pump, And this is a small air compressor. It's designed to be run for years at a time. It's a type of diaphragm pump. So it only has these two rubber pieces that oscillate back and forth or move back and forth. So there are no metal pieces moving back and forth, which allow it to run for a very long period of time. We have tubing that connects from the pump to the flow meters and out to the baby. Occasionally this tubing can become disconnected, so that may be a common issue, but it's very easy to go into the machine and just reattach the tubing. We also have an electronics box back here, and that is an alarm for the system that will sound after 10 seconds if power is lost to the unit. So that alerts the user that the baby is not receiving therapy, the machine is not currently working, and typically we recommend that the baby go on oxygen if it's available until power returns to the ward. And then there's also on the other end here, we have a spare parts kit that is attached to the wall, and this can be removed, and it includes a spare filter. So you may need to replace the filter that is under the pump, maybe every 1 to 2 years, depending on how dirty the environment may be. We also have instructions on how to remove and replace the filter. It's very simple to do. We have a spare bottle tubing as well, so if the bottle tubing gets lost, the user can go in and find this extra bottle tubing, and they can also buy additional bottle tubings as well. We have spare fuses and spare screws for the outside of the unit as well. And the folded paper here is a maintenance log. So any work that's done on the machine can be recorded. So the last thing that I should mention that comes with the Pumani is the user manual. So each device comes with this booklet, and it provides step-by-step instructions on how to set up the machine, how to maintain the machine, and how to repair the machine if you need to. So it's a very extensive booklet, and we have electronic copies of this as well. So that is everything that comes with the Pumani. You've seen the outside and the inside of the machine, and I'm now happy to take any questions that you have.
You could actually just leave your video on in case the questions have a specific relevance to the machine. That would be helpful. So for everyone else that's on the line, if you have questions, just to kind of remind everyone, there are 2 ways to do that. You can click on that hand icon, which what that does is it raises your hand and lets me know that you would like to ask a question directly to Jocelyn. Or you can type in a question to that question section, which you can do anonymously, and then I would read to Jocelyn your question. So we have a couple that have come in, so I can start with them specifically, but if you do have questions of your own, we're more than happy to answer them at this time. So Jocelyn, the first question is just about sterilization of parts and what can be sterilized and what cannot be.
Yes, so the tubing, the patient tubing, and the nasal prongs, they're labeled as single-use only. And so that means that we cannot ensure that they are clean use after use. However, we understand most hospitals, most clinicians have to and need to clean and reuse. And so these components are designed to be reusable. They're very durable. But we cannot typically recommend that or we cannot label them as multi-use, if that makes sense. I know that's not a very straightforward answer, but I'd say users are welcome to reuse as they see fit in their hospital according to their cleaning procedures, if they're willing to take that risk of potential contamination. But we've used this tubing and the prongs in Malawi for many years, and it's been soaked in a bleach solution and hung to dry, and that works very well. So if that's what users are comfortable with, that's perfectly fine.
Okay. And is there any spare parts or consumables that are single use and you would recommend only single use then?
Yeah, so the one item that we recommend really should be changed after each patient is the hat. And I'll just demonstrate here on the doll that the hat, because it's such an important component in keeping the tubing attached, the tightness of the hat is actually really important. So we recommend that the hat only be used once per patient, so that this tightness is really is secured on the baby, so you're not loosening the hat on multiple patients. So that's the one component that we really think should be only one patient per use.
Okay, perfect. The next question we have in here is asking for just a quick demonstration again for how you would connect oxygen supply and maybe elaborate a little bit more on how to blend.
Sure, yeah, so let me put the lid back on the machine. And I actually have a concentrator right here and some oxygen tubing, so I can just do that demonstration as well. Yeah, so there is the oxygen port here where the oxygen tubing is attached. So I'll just show you with oxygen tubing where that is attached. So I have oxygen tubing here. This is on a concentrator, but it can be from a cylinder or from piped oxygen. And that would just connect to the port here. And you can read the oxygen flow on the oxygen meter here. And then on top of the machine, we also have, try to bring this a little bit closer. We have a blending table. It's a little bit hard to see at this angle, but I'll show you inside of the manual. Essentially, this table provides the oxygen flow and the total flow that will give you different levels of oxygen or fraction of inspired oxygen that's delivered to the baby. So let me just show you the page in the manual. That might be a little bit easier. So this table is on top of the machine, and then we also have a table in the manual. And how this works, essentially, in this example, so at the top you would choose what your total flow rate should be. So that's the amount of air being delivered to the baby. So we'll say for this example that we want the baby to receive 8 liters of total flow, and we would like them to receive 60% oxygen or 60% FiO2. And where these two values meet is 5 liters, and that is what your oxygen flow would be. So I've set my total flow to 8 and my oxygen flow to 5, and that will give me 60% oxygen in the baby's airway. And so you can do a variety of different settings to deliver different percentages of oxygen to the baby.
All right, excellent. Thank you very much. Just a question about power supply. Is there battery backup? Just if you could elaborate a little bit about the power.
Sure, yeah, so there's currently not a battery backup, so we recommend that the Pumani is used in facilities that have fairly regular power or have a generator to provide backup power. There are fuses in the power cord as well as in the machine itself, so if there are voltage spikes, it's possible that the fuse in the cord or in the outlet on the back of the machine may blow, but that protects the machine, and we have spare fuses that can be replaced inside of this. There's a small drawer here, so that prevents damage to the machine if there are voltage spikes.
Great, thank you. And then a question about warranty, which I know is on our product page, but if you could just tap onto that very quickly.
Yes, so we offer a 2-year warranty for the machine, and that includes any normal wear and tear excuse me, it does not include normal wear and tear, and any defects that are due to manufacturing. For the accessories, so the spare parts, the starter kits, any of the consumable items, we provide a warranty until the packaging is open. So if there's any sort of defect, be sure to inspect that and let us know before the packaging is open. Once the packaging is open, we cannot provide a warranty for those items.
Perfect. Do you have any, the next question is, related to continuous use, how long can it be used continuously?
Yes, so we have had several machines used in our office for over 3 years continuously. We've never turned them off. They're still functioning perfectly. And I'd say in a clinical setting, that's not usually the case. So babies typically on CPAP anywhere from 5 to 7 days is average. Some babies can be on for 3 or 4 weeks if they have a really severe condition. But even then, once the machine, once the baby is off of the therapy, maybe the clinician will turn off the machine for a few minutes or a few hours, but then it can be turned back on and used for weeks or months at a time. So there's no need to turn off the machine and let it rest. It will function perfectly fine for weeks or months or even years, so that's not a concern. The machine, the pump inside of the machine will get a bit warm, but it's not to an unsafe level, and we also have air vents on the back of the machine in case the environment is very warm and the pump is warm. This allows some of the air to get inside the machine as well. So we've used the Pumani in very warm environments, and it still functions very well.
Thank you. The next question is related to filters. Do these need to be replaced each time, or can they be washed? There's a couple other CPAPs that have been mentioned by the person who's asking this question that can be washed instead of replaced.
Right, so you can wash the filters as well. It's possible that when you're removing the filter to wash it, it might tear, which it can still be used, but if it's torn significantly, you can always just use a new filter as well. So it's similar to a concentrator filter. If you've seen a filter on the back of a concentrator, the difference with the Pumani filter is that it's inside of the machine, it's below the pump, so it's not as exposed to the outside environment, so it should not get nearly as dirty as an external filter on a concentrator, for example. So cleaning or washing or replacing should only need to happen every few years, not nearly as frequently as an external filter.
Okay. And then as far as monitoring, does this then require a separate pulse oximeter?
Yes, so we do recommend that pulse oximetry is used with the patient to monitor their blood oxygen level prior to going on CPAP, during their CPAP therapy, and afterwards if required. So Pumani, it does not include pulse oximetry. That is another component that would be needed to provide CPAP. Oxygen is another component that's not provided. Suction machines are also very useful in clearing out the airway. And obviously, like suction tubes and feeding tubes and all the components that a baby having a respiratory condition would also need.
Perfect. And then, is it a must that it's connected to external oxygen supply?
It is not a requirement. We found for most patients, especially to premature babies, that they typically need additional oxygen. But for some of the older babies, so 6 months up to a year old, babies with bronchiolitis that might just need the extra pressure to keep their airway open, they can do very well on the Pumani without additional oxygen. So I think some people may be surprised that some babies, they just need that pressure. And so if a hospital doesn't have regular oxygen or is treating a lot of older babies that have conditions that don't require oxygen, this can still be very useful. But I'd say for the smaller, the premature babies, most of them will need oxygen.
Perfect. Just see if there's any other questions here. The one last one I see is a couple people asking about consumables, spare parts, where to get them. So that's something you can always connect with me about for any orders for the Pumani itself or for any spare parts, consumables, replacement pieces. Those are all available through VIA Global Health. And so you can connect with me directly or go to the page and request a quote there. The only last one I see that, unless more come up, one more that just came in. Does the machine compensate for any leakages?
Any leakages? In terms of a leak from the oxygen source or a leak in the system, I think, so I guess in general, the CPAP, the Pumani system, is a closed system, so the air coming from the machine being delivered to the baby is all closed, and that ensures that the pressure being delivered to the baby is what it should be. I can also just show you on the doll here that there is, at the end of the tubing here, so we have the tubing from the machine to the baby. And on this end here, we call this the end cap. And there's a small hole here. So this is the only point where there is a small leak in the system. You may not be able to see this on the screen, but there's a very small hole, and that allows for any additional exhale to release from the tubing. So we've done a lot of testing on this piece in particular, and this ensures that the pressure is still stable at the nasal prongs, but it allows for exhale to release at the end cap. So I think that was the question about leaks. They're also inside of the machine. If there are leaks in the system, the total flow will not be as high as it should be. So that will alert the user that there may be a leak in the system, and the user can go into the machine and reattach the tubing if they see that there's a leak. Or it's possible they may hear it as well. But leaks inside of the system should not be happening.
Perfect. Yeah, yep, there was a little clarification there that it was specific to the cannula itself, which sounds like you answered that question well.
Right. Yes, and just to speak on the cannula too, many of you who are familiar with CPAP, you know that the tightness of the prongs in the nostrils is really important. There really shouldn't be leaks at the nostrils, so the prongs should be tight in the nostrils, and the 6 different prong sizes that we provide allow you to adjust the size as you need to. So we've also seen in some cases, let's say a baby starts on size 2 prong, but over several days their nostrils might start to slightly expand and they start to have some leak at the nostrils, and then you can upgrade to a size 3 or size 4 prong. So that's commonly done in the US as well, and you can do that with our set of prongs as well.
Perfect. It looks like the questions are slowing down a little bit, but just did have a couple more. One is just, where is the Pumani being used at this point? You don't have to list every country, but just an overview of the areas where the Pumani is being used in the field.
Sure. Yes. So the Pumani, as I mentioned, was initially developed with clinicians in Malawi. It was first evaluated in Malawi and distributed in Malawi, and we are now in over 30 countries, primarily in sub-Saharan Africa, but several Asian, Central American, and South American countries as well.
Perfect. Other questions keep coming. So one is asking about the one, complimenting you very well on the nasal cannulas and the quality, but also then asking if they're compatible with other CPAPs that are not Pumani brand.
Yes, they can be. So it depends on your CPAP setup, but I'll just show you the prong tray here. So as I mentioned, they're similar to the Hudson prong design. So if you have tubing that would interface with this width on each end of the prong, then it could be used with other CPAP machines, but you'd have to confirm that it does fit your tubing. And I would say that these are designed for the Pumani connections, for the fish elbows that we've designed. So ideally they are used with our tubing and our connections and the Pumani machine, but they could potentially be used with other CPAPs as well.
And this might be a good opportunity to explain to the folks on the line that are looking to sell this product why they wouldn't want to use your consumables with any other machine but the Pumani. So why is the Pumani better and different than the competition?
Yeah, so in terms of the consumables, we have designed the Pumani specifically so that the tubing cannot get mixed up. It's impossible to connect the bottle tubing to the patient port or the patient tubing to the bottle port. We think that's really important. You don't want to be delivering improper therapy to the baby, and by using the Pumani with the Pumani accessories, that will ensure that the device is being used properly. And anytime that you're using different tubing, different prongs, different connectors, there's always a greater risk for disconnection or user error or leaks at different areas. So as much as possible, it's best and safest to be using all of the components with the Pumani.
Great. And what are the key differentiators for the Pumani for why someone should buy this machine and not another competitor?
Yeah, so the Pumani is one of the only CPAP devices, and I would say the only CPAP designed for Africa specifically, that actually has an air compressor inside of the machine. As surprising as that is, most CPAP devices do not have an air compressor. So in US hospitals, for example, typically there's piped compressed air and piped oxygen, and CPAP systems are attached to this piping system, and that is delivering the CPAP. But as you may know, in many African hospitals, low-resource hospitals, this piped air and piped oxygen is not available, and so you need a CPAP that has that compressed air. And so the Pumani provides that compressed air in a very effective and affordable way. And our compressor, I should also say, has been upgraded several times to ensure its longevity. So we originally used a low-cost diaphragm pump that worked for several years continuously, but we found that there was a pump that was very similar but even more durable, and we've since replaced the previous pump with this new pump, and now the lifetime should be at least 5 years, if not longer. And I believe we also, this device has been in design and development for over 5 years, working very closely with Malawian nurses, pediatricians, clinical officers, the Ministry of Health, and they really had a significant contribution to the design and the development and the training materials as well. And so it's really been designed specifically for these users and with these users, and I think that's really important for these environments. And I should also mention that in addition to the machine and the starter kits, everything that I showed here, we have a set of online training videos and training materials. So we have at least 10 videos that go through the machine and the setup and attaching to the baby, so everything I went through here today and more. And then we also have printed material. So the user manual, we have weaning guides, increasing CPAP therapy guides, how to determine if a baby needs CPAP. So really everything that you would need to know about setting up and starting and ending CPAP therapy. And I believe that sort of the training videos and the materials, I don't believe is provided by any other CPAP company.
Great, thank you. Just a couple more and then I'll let you go before too long. But one about the any publications about the Pumani, especially recently.
Yeah, so we have a technical evaluation that was done in the US comparing the pressure output of the Pumani to a bubble CPAP system already in use in a US hospital. So that showed that the Pumani was comparable therapy to a US CPAP. We also have a clinical evaluation that was done in Malawi, as I mentioned, early on in the Pumani evaluation, and that showed that rates of mortality on the Pumani significantly decreased compared to oxygen therapy, which is to be expected. We know that CPAP is very effective, especially for premature newborns in respiratory distress, but this study really showed that in a clinical setting, the Pumani does do what it's supposed to do. More recent publications are in process. So we work very closely, as I mentioned, with the team in Malawi, as well as at the Rice 360 Institute at Rice University. They have data from over 3 years of Pumani implementation and use, and that publication should be available very soon. It's not published online, but it should be available very shortly. Then we have other publications or other data being collected in Nigeria, Rwanda, potentially other countries as well, but the timeline for that data collection and publication may be a bit longer. But we're always interested in clinicians who are looking to do studies. We know that clinicians really prefer to have studies done in their own countries if possible. So if you're interested in conducting a study, we're happy to provide support in how others have set up studies, what we would be evaluating. Obviously, as a company, we would not be working directly with evaluators, but happy to provide support as you're planning for a study if you'd be interested.
Perfect, thank you. And for all those on the line, the studies and publications, training videos, technical specifications, brochures, things like that that Jocelyn has mentioned are all available on the Pumani product page on the viaglobalhealth.com site. So if you wanted to see those all aggregated in one place, I'll show you the link to that in just a moment as well. So I'll do just one more question before we let you go, and I think I already know the answer to this, but I'll let you touch on this because it'll have the benefit in the final video. Would you recommend this be used for adults for sleep therapy, or is this specifically developed for newborn only?
Right, so the Pumani is designed for newborns and young children up to 1 year of age. So the pressures and the flows would need to be higher for older children and for adults. And the patient attachment and the nasal prongs are not designed for older children and adults. So it really is geared towards newborns up to 1 year of age, or approximately 10 kilograms in weight. So that does somewhat limit how much you can use the Pumani, but we have found that for this patient population that is most in need of CPAP therapy, that this Pumani is most effective for those patients and can really reduce mortality. So that's why it's been designed specifically for that group.
Perfect. So I'll just switch the presentation to go back to show my screen as well. But we'll keep the video up there just as a final thank you to Jocelyn for demonstrating and for taking through the many questions that everyone has. If anyone has questions beyond that for pricing, ordering, anything, details that you want to learn more about the product, or even to request the final video afterwards, you can contact me there, which my information is shown on the screen. There's also the link to the product page there for the Pumani. And the easiest way to do that is just to go to the viaglobalhealth.com site, and you'll see the Pumani listed in our featured innovations, or you can search for the Pumani just there on the site. So with that, if you have questions, follow up, but I want to thank Jocelyn for the demonstration and for taking the time out of your busy morning.
Thank you. It was great to participate, and thank you for all of your questions.
And thank you to everyone else on the line from all over the world. If you have questions, feel free to follow up. But thank you for your interest and your engagement. Everyone have a good night.